Certainly correction of prominent ears can make a dramatic difference to patients. We do prominent ears from 4 years up. It's really when kids become about 7, they become body conscious and start to get teased. But the so-called bad ears or the prominent ears, again, from marked prominence to very marked prominence, but they can be a great source of teasing and for kids. And that's the reason we really start at 4, before they go to school, before they start getting teased and be psychologically affected by it. Having said that, I've had 60-year-olds come to have their prominent ears done who've hated their ears their whole life. And there's a whole pile of people in between that. Prominent ears are really a manifestation of the ear not quite making it across the finishing line. The last thing that happens with the ear is the fold on the outside of the ear forms. People with prominent ears have that fold absent usually, or deficient, and that makes the ear look deep with a deep bowl and sticks out from the side of the head. So what we're trying to do with a prominent ear correction is recreate normal anatomy. So we go in behind the ear, the scars are all behind the ear, we come through the cartilage, we score the cartilage and weak it, refold it back into the normal fold, or close to the normal fold as we can do. We suture it in that position, and we hold it back, and we remove excess skin from behind the ear. The idea is not to plaster the ear beside the side of the head. The idea is to bring the ear back into a normal plane beside the head so the ears don't stick out. And that can certainly make significant differences to people who, you find young males who get their hair cut for the first time. They're used to having long hair just to cover their ears. Girls will do the same thing, cover their ears and be paranoid and concerned, and to a point where I've had a girl who couldn't go for a waitressing job because of a requirement that she had her hair pulled back as part of the job. And she wanted to get her ears fixed so she could work as a waitress in this particular shop. So again, it's with all sort of cosmetics or plastic surgery. These little things can very significantly affect people's lifestyle and their perception of themselves and how they interact with normal society. This is not a particularly painful operation at all. When the patient's asleep, we certainly put long-acting local anaesthetic in, which will last for up to 24 hours. We universally do it as day surgery. Patients do have a head bandage on. Certainly you may have some bruising and swelling with your ears for at least a couple of weeks. And I would generally have you with a head bandage on for 5 or 6 days. So you won't be very socially presentable, but certainly you're functionally normal. You'll be on your computer working the next day. It's always done as day surgery. It is considered a medical procedure no matter what age you are. So there are Medicare item numbers associated with it, and certainly you can get rebates if you're in a private health fund.